My name is Erica Merritt. I am a family nurse practitioner student at Maryville University. This is Wes. He will be my patient for our head-to-toe assessment. Prior to the exam, he removed his shirt for ease of examination and also emptied his bladder. We did a full set of vitals. His height was 6 foot. His weight was 160. His blood pressure was 115/67. Heart rate was 64. Respirations were 14. SpO2 was 100%, and his temperature was 98.4. We also did VAR vision testing using the Snellen chart, and his vision was 20/20. Prior to the exam, I'm going to go ahead and sanitize my hands, and then I will start with the inspection of the face and the head. His head is upright and rounded. There's no obvious ticks or tremors, no masses present. The skin is intact and pink, and I don't see any obvious lesions or rashes. His eyes and ears and nose and mouth are all symmetrical on his head. Now I will also inspect the movement of his cranial nerve muscles and symmetry of that. Can you raise your eyebrows and close your eyes tightly? Okay. Smile, puff out your cheeks, and stick out your tongue. Okay, he had good symmetrical movements with all of those items. Okay, now I'm going to move to the the palpation. Can you lower your head for me? Let me know if you have any tenderness.
No.
I don't feel any depressions, no masses. His hair, the texture is soft and fine. There is thinning at the crown of the head. I don't see any nits present. There's no scaling noted on the scalp. Go ahead and look that. On his face, I will palpate his face. Do you have any tenderness of your face?
No.
And then the frontal sinuses, any tenderness or pressure?
No.
And the maxillary sinuses, tenderness or pressure?
No.
Okay, and I didn't feel any masses with that palpation either. Next, I'm going to do palpation of the temporomandibular joint. Can you open and close your mouth? Do you have any pain, clicking, or popping? And then side to side. Again, any pain, clicking, or popping?
No.
I also did not hear any clicking or popping or feel any of that. All right, next I will go to touch sensation. And can you close your eyes and tell me what type of a sensation you feel and where you feel it?
Sharp forehead, dull cheek, sharp chin, dull chin, sharp cheek, dull forehead.
Okay, open your eyes. And did you feel that sensation equally on both sides of your face? Okay. Next, I will move to the examination of his eyes, and he has eyebrows that are present on both sides, and they grow upward and out toward the outer canthus. He has eyelashes that are present on the upper and lower lashes that grow up and out away from the globe. I don't see any orbital swelling or redness. There's no obvious ptosis, no tics or tremors. His sclera is white, and the conjunctiva is pink bilaterally. His eyelid, when his eyes are open, cover a portion of the iris on both sides. Can you close your eyes for me? I don't see any tremors of the eyelids either. They do close completely on both sides. I'm going to palpate your eyelids. Do you have any tenderness?
No.
And I don't feel any masses, any tenderness.
No.
Okay, with the lacrimal apparatus palpation, there's not any excessive tearing either with that. For testing of cranial nerve 7, you would do a taste test, and we're going to skip past that due to time. Cranial nerve 5 was tested when we did the touch sensation, and that was all intact as well. His eyes also, we're going to test cranial nerve 2. And if you can read that about 14 inches from your face, left to right, the lowest line that you're able to read.
428.739.
Okay. And so that shows a vision of 20/20, which is good. I will also inspect the eyes for a direct response with a pen light, and then the consensual response of the opposite eye, and then the direct response and consensual response, and his pupils are equal and reactive to light accommodation on both sides. All right, next we're going to check for extraocular movements, testing cranial nerve 3, 4, and 6. And if you can just follow the light with your eyes only. And I'm looking for any nystagmus or involuntary movements of the eyes. And I don't see any of that. Okay, next I will do his ophthalmic exam with the otoscope. And I'm going to look at the color of the eyes bilaterally, and it's blue. And then I'm going to look for the red reflex. And then the blood vessels, and they are intact. There's no hemorrhaging noted. The clarity of the lens, it's clear. I visualized the disc and the macula, and also looked at the depth of the anterior chamber. I also don't see any lesions present on either of his eyes. I will do a peripheral vision check. If you could cover your opposite eye. Okay, and tell me when you see my fingers in your peripheral vision.
Yep.
Okay, and then cover your opposite eye. And then again, when do you see my fingers?
Okay.
Okay. So his peripheral vision is intact on both sides. Next, we will do inspection of his ears. And I'm just going to look at the color of the ears, and it's the same as the face. His ears are symmetrical on both sides. They line up with the outer canthus on the face. I don't see any obvious masses or nodules present. Palpation of the ears, they're firm and mobile, and I don't feel any masses with palpation. I'll do inspection of the ears with the otoscope, looking at the canal. I don't see any redness or drainage. There's no cerumen present. The tympanic membrane is pearly gray. And I don't see any bulging perforations or retractions of the tympanic membrane or fluid noted. Okay, next I will do a whisper test. If you can cover this ear over here, tell me what word I'm whispering.
Green.
And that's correct. And then we'll move to the other side, close the opposite ear, and tell me what word.
Rainbow.
Yep, that is also correct. All right, next we'll check cranial nerve 8, doing the Weber and the Wren test. And if you can tell me if you hear this equally on both sides.
Yeah.
Okay. And then I'm going to place it on the mastoid bone. Tell me when you no longer hear it there.
Okay.
All right, and do you still hear it?
Yes.
Okay, tell me when it stops.
Okay.
All right, and then we'll do that on the opposite side. Tell me when you don't hear it.
Okay.
And do you still hear it?
Yes.
Tell me when it stops.
Okay.
Okay, so on that test, air conduction should be about 2 times greater than bone conduction, and it was for him. So now I'm going to inspect the nose. It is midline on his face. I don't see any obvious deviations. There's no lesions or masses that are present. It is colored pink, just like his face is. I'm going to look in the nares with the otoscope. You can set your head back. Okay. The turbinates are pink and non-boggy. The mucosa is moist. I don't see any drainage or obstructions noted. The septum is midline and not deviated. We're going to check palpation of the nose for any tenderness or masses that hurt at all. And I don't feel any masses with that. We're going to check nasal patency. If you could close one side of your nose and breathe in and out just with your nose. Okay, and the opposite side. All right, so his nasal patency is intact on both sides. Cranial nerve 1 test would be the smell test. We will move on past that due to time restrictions as well. So now I'm going to do inspection of his mouth, starting with the lips. His lips are symmetrical on both sides. They're pink and moist. I don't see any lesions present. And then I'm going to inspect inside of your mouth. If you can go ahead and open up. Going to look at the gums and the buccal mucosa. I don't see any lesions or redness, no bleeding. The gum margins are tight along the teeth. All 32 teeth are present. There's no cracking of the teeth. I don't see any dental decay. The surface is smooth and white. The hard and soft palate is intact. No lesions are present. His tongue is midline, and it is slightly rough, pink, but moist. Can you put your tongue to the roof of your mouth? And it's still midline, no tremors. The frenulum is intact. I'm going to check cranial nerve 8 and 9. Can you swallow for me first? Okay. And then open up. Say ah.
Ah.
Okay. With that, the uvula was midline. It did rise and fall with him saying ah. The anteroposterior pillars are present. He has tonsils present on both sides. They are not red or swollen. There's no exudate present on those tonsils. The posterior oropharynx is smooth and glistening, and I don't notice any odor to his mouth as well. Next, I will move to testing of cranial nerve 12. And to do that, can you stick your tongue out and down towards your chin, and then up towards your nose, side to side, and then inside your cheek if you can push against my fingers. And then again on this side. All right. Muscle movement was smooth and symmetrical with that. There weren't any tremors or deviation while he was doing that. Okay, next we're going to do inspection of the neck. And it is smooth. The musculature is symmetrical on both sides. I don't see any swelling. The thyroid's not swollen. The trachea is in midline position. I don't visualize any jugular vein distension. The skin is pink and intact. There's no lesions or masses that I note with inspection of his neck. So I will do an inspection of his passive and active range of motion. Can you bend your head forward? And then against my hands, press, and then back, and press against my hand, and to the side, and press, and to this side, and press. Okay. And he had good resistance with that and good range of motion. Did that cause you any pain? His movements were smooth as well. So for active range of motion, this will test cranial nerve 11. Can I get you to shrug your shoulders? He's got good symmetrical movement. And then against resistance, good resistance, and turn your head side to side. Does that cause you any pain with any of those movements? Okay, and those were smooth and symmetrical as well with each of those motions. So cranial nerve 11 is intact. So now I will move to the palpation of his neck, and I'm going to palpate one carotid pulse at a time. Okay, and that is strong and equal on both sides. I'm also going to palpate the trachea for its position, and it is midline. And then the thyroid. You swallow. All right. And it is smooth. I don't feel any swelling of the thyroid or any goiters or masses with that swallowing. Next, I will do palpation of his lymph nodes. Tell me if you have any tenderness with the occipital,
No.
the postauricular, preauricular, tonsillar, the submandibular, submental, posterior cervical chain, superficial anterior cervical chain. All right, and then turn your head, and I'm going to check the deep cervical and the supraclavicular and infraclavicular. Arm up, check your axillary. Okay, and then turn your head the other way. Again, the deep cervical, and supraclavicular, the infraclavicular, arm up, and the axillary. Any tenderness?
No.
And I didn't feel any swelling or nodules with that, which is to be expected. So now I'm going to auscultate his neck, and I'm going to do that with the bell of the stethoscope. And if you can take a breath and hold it. do the carotid and the thyroid. Okay, and breathe. I don't hear any bruise with that auscultation, which is to be expected. All right, so now I'm going to do the inspection of the upper extremities. I'm just looking at the muscle mass, and it is symmetrical. The length is equal on both sides. Skin color is pink. I don't see any edema with that. Palpation, any tenderness?
No.
I don't see any edema. Capillary refill is less than 3 seconds. The nail beds are smooth and firm, and the base is hard. There's no clubbing of the fingers noted. Going to also palpate then the brachial pulse and the radial, and that is strong and equal on both sides. Now I will do a check of his deep tendon reflexes of his brachial tendon, and then the other side. And deep tendon reflexes there were about 1+. I'm also going to do range of motion and strength testing while we're here. So if you can put your arms out, press against me, and down, out, and in, bend your elbows, put your hands behind your head, and down your back, and then switch and go up the bottom side of your back, okay, and behind your hips, across your chest. Did you have any pain with any of that? All right, and his muscle movements were smooth and symmetrical with that, all of those movements, and strength was strong. Okay, so we will now move to the inspection of the posterior chest. If you can stand and let me look at your posterior chest. Okay, I'm inspecting for chest rise and fall. He's got equal chest rise and fall. Skin is intact. I don't see any masses or lesions that are present. No obvious skeletal deformities are present. I am looking at the AP diameter versus the lateral diameter, making sure that the AP is greater than the lateral, and his is. I will palpate the bony structures. Any tenderness?
No.
I don't feel any masses with that palpation. I'm also going to palpate for tactile firmitus. Can you say 99?
99.
Again.
99.
And again.
99.
All right, there's good vibration with each of those. I'm also going to percuss his costovertebral angle. Tell me if this causes you any pain.
No.
And that.
No.
All right, that's good. It should not cause any pain. Checking expansion. Can you take a deep breath in and out? And I've got equal rise of my hands on his chest wall when testing for the expansion, which is good. So I'm going to do percussion of the posterior spine systematically, moving side to side, listening for resonance or dullness. And then over the lung fields, I'm hearing resonance. I'm also going to percuss his diaphragmatic excursion. Bend slightly forward for me. And if you could take a deep breath and hold it, we're going to percuss downward and hear when resonance changes to dullness. And I'm going to mark that spot. You can breathe normal. And take a couple of normal breaths, and then if you'll exhale fully. And then go up from that point to see where it changes back. And mark that. And then I'll measure that. It should be 3 to 5 centimeters. His is approximately 4. So that is a normal result. Okay, next I will do auscultation of the posterior, listening to his lung sounds to make sure that they are vesicular and clear. With the diaphragm of the stethoscope, take a deep breath in and out. Okay, I don't hear any wheezes, no rails or crackles heard. Lung sounds are heard in all of the quadrants. From the posterior, he doesn't appear to be having any labored respirations. His effort seems unlabored and within normal limits. Okay, so if you want to go ahead and have a seat, we'll do inspection of the anterior as well as the lateral chest wall. Symmetrically, the muscle mass is symmetrical. I don't see any pulsations of the chest wall. Skin is intact. There's no lesions or masses present. He's got equal rise and fall of his chest with breathing. His respirations are an unlabored effort, and respiratory rate is within normal limits at about 14. I will palpate the chest wall just for any tenderness or masses. Any tenderness?
No.
Okay, I don't feel any masses with that. I also want to palpate tactile fremitus. Can you say 99?
99.
Mm-hmm.
99. 99.
All right, I feel good vibration with that in all areas. So now I just want to do percussion of the chest wall, just to hear the tone. And it is resonance. And then also the lateral chest wall, percussion. And again, resonance. Okay, resonance throughout. I'm also going to do palpation of the precordium for any heaves, lifts, or thrills, starting at the apex, and then at the left sternal border, and then at the base. Okay, I don't feel any of those. I also want to palpate the apical impulse at the left chest wall. Okay. All right, next I'm going to move to auscultation of the chest wall. And I'm listening for clear vesicular breath sounds with the diaphragm and stethoscope, deep breath in and out. Okay, and then on the lateral chest wall. And this lateral chest wall. Okay, those are all clear and vesicular. No wheezes, no rails, no crackles noted. Breath sounds are present in all lobes. So now I will do auscultation of the heart tones starting at the aorta area. Listening for any abnormal heart sounds, and then the pulmonic and Erb's point, tricuspid, and mitral. Okay, he has normal S1, S2 heart tones. I don't hear any extra heart tones. There's no murmurs, no gallops, no clicks or rubs noted with that auscultation. Due to time, we're going to move past bronchophony, egophony, and whispered capillarity. So if you could go ahead and lay down, we'll do inspection of your abdomen. The contour of his abdomen is mostly rounded. Skin is pink and intact. I don't see the presence of any surgical scars. There's no obvious pulsations to his abdomen. I will do auscultation of his abdomen in all 4 quadrants, starting in the right lower quadrant, listening for bowel sounds up to 2 minutes. And he's got some hyperactive bowel sounds that are high pitch and tinkling. And then with the bell of the stethoscope, I will listen to the aorta for any bruits and the renal arteries and postiliac and the femoral. Okay, and I don't hear any bruits with that. So I will move to percussion of the abdomen just for the tone. I'm going to percuss the liver borders. Should be less than 10 centimeters. And his is. And then percuss for splenic dullness. And that is. I'm going to move to light palpation. Tell me if you have any pain with this. Okay, and I don't feel any masses. And deep palpation, any tenderness?
No.
And again, I don't feel any masses. I will feel the aorta for any pulsations. And I don't feel any. I'm going to palpate the right costal margin for the liver borders. And then the left costal margin for the spleen, which I don't feel, and that is normal. I'm going to palpate the kidneys. If you can take a deep breath and hold it. Okay, and then the left. All right, you can go ahead and breathe. Okay, so if you would like to go ahead and sit up, we're going to do inspection of your lower extremities. On the lower extremities, I'm looking at the muscle mass to make sure that it's symmetrical. There is hair distribution that is even throughout and present. There's no obvious masses or lesions present. I don't see any edema. Temperature-wise, the skin is warm. There's no pitting edema. And the skin is dry. I will palpate the popliteal arteries and the posterior tibial and the dorsalis pedis, and it's strong and regular on both sides. I also want to do deep tendon reflexes on his patellar. And response is 2+ there. And then on the Achilles tendon. And again, he's got a 2+ response with that as well. If you could put your legs out, we'll do some range of motion and strength testing. Can you pull up with your toes, and down, out, and in? Rotate your ankles, bend your toes. All right, you can go ahead and put those down. I will do some neurological exam on him. We did his cranial nerve testing. We have talked about his temperature, talked about taste and smell, cranial nerve testing, and he is awake and alert. He's been able to answer questions appropriately, so I would assume that at this point he is neurologically intact. Can you also grip my fingers? And he's got equal grips with his fingers. So we'll move on to the final range of motion testing because we're going to go past 2-point discrimination due to time. Go ahead and stand up, and we're going to finish your range of motion testing on your spine. So can you bend side to side, and then back, and then circular motion? Do you have any pain with that? All right, he's got symmetrical movement. With that, we already had him bend and touch his toes, so we know he's able to do that. We were going to go past the hip and the rest of the knee range of motion and strength testing due to time restraints as well. So that should conclude my head-to-toe assessment, and thank you.